Good afternoon and welcome to Future State. Industry leaders discuss today's priorities and tomorrow's challenges. A Health System CIO Media Inc. production sponsored by Formstack. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor in chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box. We'll take them later in the program, and we're going to do a little audience poll later on to get you involved. Nice way to view the screen. Click on the top center, get it in side by side mode. Then you can adjust the divider to get the video boxes and the slides the size you want them. And it should say speaker view in the top right hand corner. Just so you see how we're going to spend our time today, first we're going to go about 35-40 minutes with our main panel discussion featuring Joel Venko, SVP and Chief Information and Digital Officer with Bay State Health. Jackie Monson, VP, Chief Technology Risk Officer, CISO, and Chief Privacy Officer with Sutter Health. And Chris Byers, CEO with Formstack. So let's get right into it. A lot of ground to cover, and I think we're going to have a lot of fun. Joel, let's start with you. Can you give us an overview of your organization and your role?
Sure. So as you just mentioned, I'm the SVP Chief Information Digital Officer. The digital title came actually as a result of what we'd seen in the pandemic. In other words, digital has become finally a thing, and I think a lot of us are seeing a lot of movement, particularly in health systems that have been mostly traditional, if you will, really focusing on digital and data, and somebody's got to own it. So we can talk certainly more about that. But Bay State Health is a large health system in Massachusetts. It's the largest in Western Massachusetts. We have roughly five and growing hospitals. And we have about 100 medical groups peppered across Massachusetts. We also have a medical school that is affiliated with UMass Medical School, focused on population health and primary care. We also have a commercial health plan that we own, and then we run 2 ACOs. And so we've got a lot of stuff going on at Bay State Health. It's certainly still focused on the COVID, phasing, or rather the COVID pandemic, and phasing out of that. And then we're hoping to get back to our core mission, which is population health and community health. So thanks for having me.
Very good. Thank you, Joel. Jackie?
Good morning, or I guess it's good afternoon on the East Coast. I'm accountable for, as he mentioned, the technology risk function, information security, and privacy, which probably the only time that it's ever highlighted having too many roles is during the pandemic, when there was a lot going on. I work for Sutter Health. It's a large integrated healthcare system. We have 60,000 employees. We see about 3 million patients a year, 24 hospitals, lots of ambulatory surgery centers, clinics, and about 12,000 physicians affiliated with. So been a very busy time, as you can imagine, being in California where the pandemic was heightened, and lots of job titles with lots going on, both related to cyber and related to data. Wow. And I'm happy to be here.
Yeah, you got a lot going on. We're looking forward to picking your brain, as it were. Chris?
Yeah, I'm Chris Byers. I am the CEO of Formstack, and we are an organization based in two key headquarters, Indianapolis and Colorado Springs, but then we have actually had a remote team well before the kind of full pandemic hit. So it's a pretty normal way of life for us, but we help people really automate workflow. And so do that, especially for the non-technical user. And so we think about the problems that you have in your kind of day-to-day communications with customers or patients or whomever. So for instance, in healthcare, we're helping automate patient experience, let people fill that paperwork out before they show up, and make sure it's getting kind of communicated to the right people into the right systems, so that all of a sudden that patient experience is improving. So thanks for the opportunity to sponsor today, and it's great to be here.
All right, very good, Chris. Thank you. All right, well, let's jump right into one of our main first questions. Jackie, let's start with you. What do you see as the main trends healthcare IT leaders need to be positioning their organizations to handle? And what is your advice for doing so? I think today, we got a very interesting panel, different focuses. So just for you personally, how do you want to take this question?
Yeah, so I think the organization as a whole, given the pandemic that I think Joel mentioned, things have changed significantly. We're in a virtual care environment, so digital transformation is probably the number one priority of the organization. From a security standpoint, it just means that I need to run with the technology and whatever we're going to do in that regard. We had to rapidly deploy a telemed platform that's probably not ideal for our clinicians. So we're relooking at that. And we're just looking at how we provide care now to meet people where they are, which is very different than I think the transformation was before the pandemic. And then specific to my areas, cybersecurity is front and center. Obviously, with remote work and all of the sort of interconnectivity now that we have to everybody being everywhere, it introduces a lot of additional risk. And then we've seen the cyber hackers focus on healthcare. They want the COVID data now around vaccines. They want anything that's valuable with respect to research around these areas.
Hmm.
And they also know that healthcare is vulnerable. And so we've seen, a huge increase, over double or triple what we were seeing as threats to our organization since the pandemic, and it really hasn't lightened up as people might expect it to. So that's really been the focus, and everything around cyber. So not just how do we better protect our perimeter to the best that we can, and internally, how do we protect through network segmentation, but also, what do we do with our third parties who, for a long time, it's not really a new problem in the sense that they've always had vulnerabilities that impact the healthcare system, but it's just becoming a very huge highlight past the pandemic. Is again, that's where their focus entry point is to the organizations. And so what can we do to help them better protect themselves and the domino effect of having connectivity to them to provide healthcare to our patients?
Yep, yep, lots of stuff there, and we'll get into more detail. Chris?
To me, I think with that digital transformation is really thinking about engaging that customer experience and patient experience. And the thing I think about is that self-service moment, because the moment I can actually give the patient more ability to self-serve, all of a sudden I've saved myself a ton of time on the back end too, because I don't now have to take paperwork that they've filled out and not be able to translate it quickly or re-enter it into a system. That process happens it kind of seamlessly. But to me, that self-service moment also comes with post-care work too, where you're trying to check in with patients and letting them do some of that work for you. They want to do that work for you because they love sitting at home, being able to do it without having to pick up the phone and not have to engage quite as heavily. We've all gotten used to very digital experiences. My mind was blown yet again this weekend when I was noticed how a lot of restaurants have actually been super successful with now taking a lot more delivery kind of orders. And I think about that experience in the patient world too. It's all about just making it dead simple for patients to kind of jump in, do the work for you and for themselves, and speed up kind of that moment of care.
Very good. Joel?
Thank you. So, I totally agree with my colleagues on the panel. I think the one thing that I would point out first and foremost is the pandemic has really given everyone, including physicians and their colleague clinicians, really a taste of what data and digital can do for healthcare. And so, prior to the pandemic, I think there was a lot of pushback, at least, for my organization.
Mm-hmm.
And I think it's natural. The traditional ways that we've done and delivered healthcare have largely worked. But, there's been quite a movement towards data and digital, particularly from outside of our industry. And having been forced to really, do virtual care, utilize data so that you can be aware of what's going on in the environment, so that you can, either readjust the way that you're bringing patients in or delivering care in a different way, I think really proved to them that this can work. Having access to digital tools and leveraging data can actually make me a better care deliverer. And so I think that has created this real dependency in a good way to healthcare technologists. And I think this is an opportunity for all of us to really, sort of muster up the courage to really push I think the initiatives that we have been preparing for, even up until the pandemic occurred. And I think those factors help. Certainly this notion of consumerism, which is now, I think has really been propelled by the pandemic even further, I think, as Chris had mentioned, is critical to the sort of the progress of digital, and that we have to again take the reins on this one as IT professionals and really push that. And that is to say that we need to leverage our digital capabilities to make care more convenient, so that consumers can get it anywhere and everywhere they would wish to get it, right? And I think that's a lot of what the trend is really moving towards. And I would say that health systems are still behind the eight ball, even more than ever now, because you've got all of these other non-traditional players who've come into the market prior to the pandemic and have just received even more funding, more velocity to really sort of delivering what they have been really attempting to deliver and have designed for in this digital world, to really sort of eat our lunch. And so I think there's a lot of that sort of moving forward. I also think that, with regards to what's happening in the world, we as IT leaders have to also understand how that is infusing and influencing the way that we design systems. And what I mean by that is that, obviously the pandemic has forced us to think about consumers even further, but also what's going on in equity and inclusion and all of the race relations. I think that also creates actually it puts us in a position where we should be thinking about redesigning how we deliver care with that lens on. And we certainly can talk more about that during the course of this discussion. But I think that also is important, because that sort of gives us a different, vantage point of how do we care for populations appropriately? How do we address things like the digital divide and social determinants? Because we saw the inequity of folks getting access or attempting to get access to the healthcare delivery system, and have failed to do so because they didn't have either bandwidth, or they didn't have the technology, or they didn't have consistent and constant capabilities to access us. So there's a lot of things that are, I think, ahead of us still, but there's a lot of momentum really looking to address those components: consumerism, digital divide, and the like. So I'll leave it at that.
All right, very good, Joel. I'm actually going to stick with you, start off with you on this. You want to talk about the top 2 or 3 projects you're working on?
Yeah, sure. So, I think one of the things that is obviously important to all of us as we, quote unquote, reopen, is how do we deal with our workforce? And I think everybody in every industry is talking about that. But that's certainly one, major project or program that we're focusing on as we continue to elevate our workforce and the individuals in our workforce. The question is how do we create a hybrid environment for our staff and our workforce, both clinical and non-clinical, because I think we've gotten a taste of working from home. And so I think that's one major issue that we've got in our hands. But we're focusing on redesigning office space. We're focusing on enabling staff to have access to different types of technologies, whether it's provisioned or not. And I know, Jackie, you're probably gonna, talk a little bit about how do you help the workforce, continue to still be safe and function in a safe manner, even if we provide them with technologies, at their fingertips at home or wherever they are going to be. And additionally, we're trying to figure out how to expand our reach across the country in terms of staff who, even as a sort of, let's call it a smaller health system compared to Sutter, but in Massachusetts, and we need skills, folks that are skilled in other parts of the country, or maybe even other parts of the world. So that's one part of, our large initiative, is making sure we have a workforce of the future, and a hybrid workforce design. The other is back to the data and digital platform. We're a Cerner shop, and we have basically solidified a large partnership with Cerner to really focus on establishing that foundation, that data and digital foundation, which will be really the stage on top of which we will drive our next 5-year strategy, our growth strategy, but also our focus on consumerism, and really the sort of the digital era for our consumers in the future. So those are two major initiatives that we're really focusing on, which I'm sure are similar to many of my colleagues across the country.
Very good, Joel. Thank you. Jackie?
Yeah, it's hard to choose sort of the top 2 to 3, because it seems like there's about 20 of them that are just as high of a priority. But a couple that I'll mention, as Joel mentioned, the remote workforce. We had a lot of what I would call our security controls locked down, from a remote workforce standpoint, purposefully. And obviously with the pandemic overnight, we had to make modifications to that. And so now we're really working through how do we make them as efficient as they can be at home to be able to work while not compromising security. And I think that requires us to completely transform how we look at the entry point for security. And so we're looking at that, and what new technology stacks do we potentially need to be able to contemplate the fact that everybody has an Amazon Echo, a Google Home, and all of these things connected now to the same network that we're connecting to. And so how do we best protect the organization while allowing our workforce to optimize the way that they do work from home? Because at least from our vantage point, we're going to be doing a hybrid model where it's partially remote work, partially in what they're calling neighborhoods or hubs where they can go work. And so this isn't going away. The other area is just really the patient experience, and sort of meeting patients where they are. As I think Chris mentioned, how do you make it more efficient? How do you enable it? And so we're doing a lot of transforming in both our, what we call our patient portal, as well as just the overall patient experience. We did a lot with, having them check in and actually sit in their car. And we realized patients actually like that versus sitting in the waiting room, being access to lots of germs. And so there's just lots of ways from the patient experience standpoint that we're really looking at. How do we transform that from a technology standpoint to accommodate that patient experience? And then we've also heard from our clinicians who at one point said it was nearly impossible to work to see patients via telemed and to be able to really have that experience. And they've realized they like it too, because it provides them a little bit of a work-life balance. And so how do we, transform the technology? And so we're working on, all that contemplates that. And then I would say the third area is really on the third-party risk management that I already mentioned. We have vulnerabilities in biomed devices, and we have vulnerabilities in virtually everything that's connected. And most of the pandemic, the security issues weren't related to our organization. They were related to our third parties being impacted and their VPN connectivity to us disconnected, and therefore creating a patient safety issue. So we're really working through, how do you mitigate that risk, and how do you work with those vendors to have better solutions in place so that they're not as impacted by a ransomware attack, and that they're prepared to respond. And then we're also looking at, what does our plan B need to be? Because for the second time we've seen a transcription vendor attack. In 2017, we saw NotPetya impact Nuance. And over the last 6 months, we also had our main transcription vendor, who we switched to, impacted and shut down. And within 24 hours, we have 1.5 or 6 million transcriptions waiting to be transcribed, sitting in a queue. And so how do we better position ourselves to have a plan B? And then what does that plan B look like? Does it look like engaging a whole nother transcription vendor for the what if, or is there some kind of contingency? And transcription is just an example. We're really looking at our critical, what I call tier 0 and tier 1 apps, to really being able to provide the patient care and their experience and help our clinicians in that area. And what do we need to do differently to be able to accommodate that? Not only do they need to have better security controls, but we also need to have a plan B, because even if they have great security controls, they can still be impacted by a cyber issue.
Wow, very good. Excellent. Chris?
Yeah, I think what I would talk a little bit about is what we try to do, and I think it applies really well, especially to some of what Jackie talked about, is we try to kind of pair up extremely secure ways to transport and house data with the ability for a non-technical user to build solutions to their own kind of challenge of moving data. And so I think about this time where you really need a lot of kind of MVP or real quick processes built, because you're not totally sure exactly what's going to work for the long term. You need something that can kind of get you through the next, say, 2-3 months, and then you'll see maybe it works perfectly, but you may also then want to build on top of that or morph it a little bit because you get feedback that it doesn't work. And I think that's something we're not always used to. We usually put things in motion because we know what the world looks like, and we can go take on a 3, 6, 9 month project and roughly trust that it's going to play out well. Well, these days you want to make sure, of course, that data is very secure, and I mean, it's always going to be top of mind, but you want to almost give into the hands of more people, departments maybe, the ability to quickly build processes and fix things. So I think about, we had a customer, Family Centers, who has 21,000 customers. They needed overnight, of course, to go to digital patient registration. I've had a lot of stories about people wanting to check in their car. And it's all about, again, getting that into people's hands to do it in the most comfortable place possible. And all of a sudden your data accuracy goes way up too. Because as you know, I've sure done it. I get real lazy when I am scribbling on a paper as fast as possible because I don't want to be sitting in the office, giving my data over. And I probably fail to actually communicate to the provider a few things that they might need to know. And so I think that helping people get in places where they can actually even provide better data turns out to be a really big win too. So for us, we're just thinking about how do we enable more and more of those people on the ground who know exactly how things are working to fix things, because they're the ones who see things best. Now, of course, that needs to roll all the way back to security, who can say, yep, this is being done in the right way, or here's the framework you should use to build. But ultimately, you're going to get a lot better, faster processes built in that way.
Hey, Chris, what do you see? Anything come to mind if you think of some of the main things that your healthcare customers have been doing with your tools? Like what are some of the top things that they're actually doing with them?
Yeah, so of course, patient registration is a very obvious one, but then along with that, you can actually create minor telemedicine experiences with data collection and forms. So let people effectively self-serve and answer a series of questions. Based on those answers, make sure you're guiding them maybe to the right kind of end person who's going to help them with their patient experience, or help them do some self-diagnosis. I mean, think about those COVID forms that we all filled out last year, where we filled out about 7 things, and then it either told you go into the hospital or do nothing. That type of kind of logic experience actually can save everybody a lot of time. And so we're seeing a lot of that. And of course, that's not the full telemedicine experience, but it does take a load off of the hospital system, which of course these days is very important to do, because every hospital system is kind of overloaded. And so those are at least a handful of things. Of course, billing experiences, making sure it's easy to pay your bill online. Those are pretty straightforward examples. And then I'd say those processes that don't actually get built into the core systems like Cerner. We have all these things that we do in our hospital that look just a little bit different than everybody else. And we can either build a custom, really expensive solution, or if we can find tools that are secure and can provide a little bit of light workflow, all of a sudden we've kind of been able to automate that. So take, patient referrals from one hospital or one doctor to the next. That's often an old-fashioned fax style, how it gets done. But really, it's just because nobody has good interconnecting systems between 2 completely separate entities. And so helping prop systems up like that in a really quick way has been effective too.
If I could just add to that.
Go ahead, Joel.
I think, and we don't use Formstack, but I'm familiar with your capabilities just a little bit, Chris. Having just researched what you guys do. I think there's merit in just sort of stating how I think during the pandemic, it really forced a lot of organizations to either, figure out how to reface certain areas, certain tools that they have in-house. Like for us, when we had to bring up a the vaccine application, none of our core applications had the vaccine application capability. But very quickly, you had lots of folks saying, "Hey, I have a potential tool. I have a potential tool." We ended up actually building our own on top of APIs that we had from our core systems. And the point is that I think there are going to be those moments now, given the fact that we were able to do that, and APIs are continuing to expand and grow. That no code, low code types of capabilities like Formstack are going to be really interesting partners for health systems who need a short solution or a short-term solution very quickly that can get them up and running, that may become maybe a longer-term solution vis-a-vis an internal application. But I think that kind of DevOps capability with low code, no code functionality is really an interesting trend, but also an interesting capability for IT organizations and health systems going forward. It just creates that nimble, I think, agile capability that we've been all looking for and seeking.
Well, and the one thing I think I'd add there is I think we're all watching the world kind of open back up, but we're not really sure what's going to happen and what that means, and probably won't know what that means for, I don't know, 6 months, a year, however long. And so I think being nimble is really important right now.
Yep. Very good. Excellent. Jackie, let's start with you on this question. Other than the trends discussed, please make one bold prediction about the future and offer advice on how healthcare IT leaders can prepare for it.
I think in a couple years from now, it's going to look very different than we anticipated. If we looked at our 5-year strategy before the pandemic, I think it was very simplified, and maybe artificial intelligence was a focus, and that was probably much of it. And I think 2 years from now, 3 years from now, it's going to look completely different. I think the way that patients experience healthcare is going to be different because of what we've rapidly learned during the COVID pandemic about how people want to receive healthcare. And I actually think it can be more affordable if we go down the digital transformation and do what I think everybody knows we're capable of doing now. And I think healthcare has to be convinced. And I think people were convinced, and leadership is convinced and bought into it. So I think the whole design and the technology platforms that are used are going to look completely different in 2 years or 3 years. And my advice to leaders would be you have to be nimble and open to it. And I personally think now is the time to run 110 miles an hour and do everything you've probably thought we should do from an innovation standpoint that wasn't an interest of the clinicians and other key stakeholders, because either there wasn't any money or they just weren't convinced that it was going to work, and actually do it and prove that it will work. And that's really what I'm excited about. And then I'm of course excited about the security piece of it, because a lot of these things we never have existed forever, right? All these homegrown tools, all of this technology is old, and it didn't contemplate security. So the opportunity to redesign it in a secure way at the same time that we're transforming is pretty exciting to me.
Excellent. Very good. Chris?
Well, one unsustainable thing that seems like we're experiencing is that the patient has actually had kind of a new and interesting experience this past kind of 6 months, a year, where they're actually getting a lot more attention because they're the only person walking in the door at that given slot, which is making probably a lot of the experience very inefficient actually on the hospital side and on the caregiver side, because they can see less throughput. And so to me, that's actually going to break at some point, and we're going to need to see almost concierge style medicine on one side. So if you want good, heavy attention, that's kind of where you're going to go. On the flip side is a very automated experience where 90% of what I used to do in office or in the building no longer happens, and it's all happening at home. And even I have a handful of devices that help me kind of indicate to the doctor or whomever my vital signs and things like that. But those two broad kind of landing spots seem like where we're going. In that middle will be the old experience of probably being in the middle won't be nearly as prominent or prevalent.
Yep. Very good point. Joel?
Yeah, I'm going to piggyback on my two colleagues here. I think that there's truly going to be more of a personalization to the way that we deliver care, for sure. Personalization through the data that we have of our consumer or our patient. Certainly personalization as it relates to using that data and predicting or knowing what the next best action is for the consumer. Personalization in a way where we can provide them with for their given either level of acuity or not in terms of their health, what's the thing that they need to do right now, whether it's continue to maintain their health or address their chronic condition, which, by the way, I think is really where what's most important right now is to understand how to guide and orchestrate someone's care. Because as we look at what's just happened with the pandemic and all of these digital capabilities that are now coming to bear, we've added more noise in many ways to the healthcare process. So there's the traditional stuff that we've got that already confuses folks because it's complex, and then you're adding a layer of technology capabilities and data and more information for folks, to try to continue to manage their care even further and in a virtual way, and so there's going to be that much more confusion. And so I think having an ability to help orchestrate and personalize the care for them is a big part of it, and that may actually also expand to the physicality or the physical buildings that health systems are now trying to figure out how to redesign. Is there going to be a waiting room? Is there not going to be a waiting room? And so I think we're going to see a wholesale set of transformations in the way that we process care at a personalized level, as well as how we actually manifest it in the buildings.
Excellent. Very good. All right. Next question, Chris, let's start with you. What are the keys to being a successful healthcare IT leader in today's environment? You're all going to answer this differently based on your jobs. Chris, what are your thoughts?
To me, it's continuing to become more of a kind of a solution consultant than a solution provider. So, of course, those key systems are always going to be maintained by IT and need to be owned by them. But IT, as they can turn into the consultant and find actually the right outsourced, I think, cloud providers often, but right solutions to actually give into the department, give into an individual, all of a sudden takes a huge load off of them and allows people to kind of get their projects through the queue much faster. And so I think where the IT team can become the expert in just how to solve problems and what are the right frameworks for solving problems. How do we actually teach people good, smart ways to solve problems and design them? I think that's going to be a really big win in the future.
Very good, Joel.
Yeah. So as with my CIO hat on, I'd say that our roles have definitely transformed over the last 12 to 16 months. Obviously, you still need to focus on operations because somebody's got to keep the lights on. But you also have to understand and be a part of growing the business through the use of data and digital capabilities, which hopefully you as the CIO have some ownership over, or at the very least a large hand in. But in addition to that, you also have to have access to innovation and design. I think sort of similar to what Chris had mentioned, because if you don't have all of those components, at the very least, as a part of your daily work, it's going to be a challenge for your health system to transform, because part of that, a large part of that transformation is going to rely on the capabilities of data, digital, as well as innovation and design. And so I think you need to have those as part of your sort of overall quiver, if you will, and that will enable you to really help push the organization from a business perspective, which is really your responsibility as well.
All right, Jackie.
I think most important to somebody who's in my type of role is resiliency. I don't think I slept last year at all, just given all that was going on and all of the transformation. So I think being resilient. And then, I'm a big fan of being proactive and partnering with operations and IS all at the same time, and never saying no unless you have to, so that's sort of my last card always. And instead is to be involved in the innovation and figure out a way to get it done in a secure manner. And so I think that's really important in this environment, because I think at this point, if an individual is negative or is going to say no, they're just going to get run over by what needs to happen to transform healthcare. And so I think that's a really important component. And I think it's just going to continue to evolve and change over the next couple of years using what we've learned from the pandemic as we continue to recover from it. And so really just understanding that. And I see this as a great opportunity for IT and operations to partner probably more than ever. A lot of times in a lot of organizations, you see sort of that separation, and operations believes they're involved in patient care, and IT just keeps the lights on for the systems. And I saw, with virtual care and all of the things that needed to happen so quickly, that partnership get even stronger than it was before and become more of a, kind of, we need both. We don't need one or the other.
All right, very good. All right, we're gonna have a little fun now. This is a poll question I came up with this morning, and I will describe it a little bit. This is an agree or disagree question. So I've been thinking a lot about security. We see a lot of things going on. It just seems like it's getting worse and worse out there, and systems are getting shut down. The bad guys are getting better and better at what they do. So here's the thinking. As ransomware continues to proliferate, security spending will rise accordingly. This keeping the lights on spending will necessarily crowd out digital transformation dollars. The point is, if you get breached, if you have a ransomware attack, doesn't matter all the fancy stuff you've got going. It's done. You're finished. So you have to create that shell in which to operate, right? I mean, Jackie, this is your job. It's so huge. And I think that you're just going to have to spend. You're going to have to spend, spend, spend. So the concept, the idea of the question is, well, is this going to diminish what's left over, because it becomes stakes to play, right? So I'll be interested in hearing both your thoughts on that. But if everyone wants to answer that, our panelists can answer it as well. Agree or disagree. Let's go, Jackie. I want to hear your thoughts. Does this sound about right, or am I crazy? Which I've been told before, so it's okay.
Well, I think there's never going to be enough money to protect organizations from what is going to happen or what continues to happen with the risk of ransomware. So I think strategically spending it on the right things allows for money to be spent on digital transformation too. As I mentioned, as we move towards new technology, we can also design it from a security standpoint that we couldn't do before. So thinking about those things. But honestly, at the end of the day, you have to balance, and patient safety is always going to come before digital transformation. That's just the way that things are looked at from a healthcare system. So I do think if we had to decide between security dollars and transformational dollars, we're going to fund security.
Yep.
Because we know that it could be extremely detrimental to the organization if we're impacted, and to our patients. We saw what happened with Scripps a couple weeks ago, and they were down for almost 6 days diverting patients. That's a significant impact, and I can't imagine what that actual final cost is going to be for them. But I think that's entirely clear, at least from my standpoint and my leadership standpoint, on what the impact would be. And if we need to invest in security, we're going to invest. But I think a lot of security professionals, they go too far in the sense that, we spend more than we need to. I think we have to be strategic about what we spend it on and make sure that we're protecting all of the most important things. And then realize that even if I have $100 million tomorrow to spend on it, I'm probably not going to protect it in such a way that if a bad guy wants to get in, they're going to get in. And so the other important piece of that is making sure that you're set up to stand it up as soon as you can to be able to respond to a ransomware issue. And so that's kind of how I look at it, as sort of the glass half full is, You got to figure out what you need to protect the organization. Yeah, you got to invest in that, and then just be really creative about how you sort of get there. But I just had this conversation actually a week ago with our board, who said, can we give you more money to move up your program maturity and better protect us so that you never have to come to us with a ransomware issue? And that's actually one of my favorite questions ever, because the answer is no. And
Hmm.
if I told you $100 million would protect us, you should probably find a new CISO, because that's just the wrong answer. It's not ever possible to spend enough money to protect. And so I think it's the balance of being able to protect as much as you can and then being able to respond. And if you can do both of those things, then I think you've spent your money well. If you haven't, then you got to spend your money better. And so I think it's always going to be a balance, but I don't disagree that, if we're talking about security over digital transformation, that security is going to come first.
Hey, Joel, it's really interesting. So the concept that Jackie's talking about when she said security is patient safety, does everybody get that now, that security is patient safety?
Yeah, I think that's the real point, and I'm so glad that she said that, because I think the boards do get it now, particularly with the Scripps incident, but even over the last year, 12 months, if you will, they've seen how it impacts care, and therefore quality of care, and therefore safety, patient safety overall. So without a doubt, that's a big deal, and one that I think should not be overlooked, and it is not overlooked at this point. I'd also add to what Jackie is saying. I think she said it all very, very well. I think one thing that, as you think about digital transformation, it's gone are the days where you just sort of say, this technology, here's a new technology, it works, let's put it in. There are considerations of integration, which are even that much more important these days. But whenever you bring in a digital transformation or even a new technology, the fact of the matter is that you must talk about how any vulnerabilities that it may provide or present to the organization are going to be mitigated. And so I think as a health IT professional, it's not just about solving the problem that has been brought to you, but it's absolutely about ensuring that you are, gonna make sure patient safety is the highest priority vis-a-vis the way that you are securing the technology. So absolutely, it trumps the digital transformation work if you don't hit that sort of first base hit. This is foundational these days.
Hmm.
Right? So I totally agree with what Jackie said.
Chris, when you're being approached now and talking to healthcare customers, is it different than it used to be in terms of where security comes up in the conversation?
I think so. I mean, I think security, of course, has always been a really big deal, but it is that balance of speed is what most people are looking for right now. I need to deploy something tomorrow or next week or next month, and yet at the same time, very early on, the conversation needs to come up around security to say what does this look like? How are we going to handle that? And I would say, especially when you're giving people, so I go back to that idea of frameworks. I think where you can apply and give frameworks to people internally about how do we handle data and how do we process it securely, it actually gives you more ability to let those end users actually create some solutions to the problems. You still need to check them to make sure that that's the case, and I think that's where people are shifting is, how do I get more of a kind of trust and verify system in place? Like let me trust you to build the right thing, and then I'll just do the verification versus I have to take 100% responsibility over building the solution from start to finish.
All right, very good. We're going to get a couple of audience questions answered. First question is, I'm going to go with you, Joel. Who owns patient experience in your organization to help drive digital transformation at the front door? I think we can all agree it is not IT or IS.
I would say that we all own it, and I know that's a sort of a punt answer, but quite frankly, the way that we do focus on it is that the whole health system owns it. But if you were going to identify one individual, it is the chief consumer officer
Hmm.
who owns it as a strategy. but it really does permeate across the enterprise, because again, if we're looking at it from an INT perspective purely, we still have to understand the patient journey. We have to design it in a fashion that is absolutely focused on the sort of the humanness of the experience. And so I would say it's across the board, we all own it, but we do have Chief Consumer Officer who was newly appointed during the pandemic as a result of the pandemic in many ways.
All right, very good. We're going to go back to our poll question, and now we're going to have the most fun, which is when I have our panelists guess at the results. And the answer I'm looking for, the number is percent agree. What percent agree with my bold statement? Joel?
I'll say 87% agree.
87. Jackie?
65.
65. Chris?
93.
93. Well, the answer is 83. 83. So that's Joel, right?
What did I win? Anything?
That's Joel.
Right.
It's in the mail. It's in the mail and it's on the way. So it might take a while. I wouldn't follow up. But thank you. No, that was good. That was good. Very good. All right. Let's see. What are we going to do here? Let's go with our Ask a Co-panelist. We're gonna use another 5 minutes here, and we're gonna have some fun. Let's go with our Ask a Co-panelist. Chris, question for one or both of your co-panelists.
Yeah, either one of you can answer, but Jackie in particular, I'm curious, have you found ways, especially with the challenges of the past year, to think about, and maybe the audience would love to hear, to simplify some of the security processes and how you go about reframing, like the old way doesn't work anymore. How do we actually embrace the new ways? Have you found some of those new ways?
I would say it's a work in progress. We're certainly looking at how we do things differently, anything from how they're logging onto their computer, do they always need multi-factor authentication? Is there another mechanism there? To, are they allowed to print from home, which we never would have allowed before? To, what happens when they're on the internet and doing their personal business on work and click a phishing email? So we're kind of looking at the whole, both the employee experience as well as the patient experience, to see if there's simplified ways. And we're going to our strategic security partners to say, can we do this differently? Because it's just not working how it is. And a lot of it's actually bandwidth of dumping all these security controls on a laptop that's now remote, that doesn't have the same connectivity that we might have if they're in a corporate environment. So I would say it's still a work in progress. And frankly, it sort of took a back seat to what we needed to run with for COVID. We quickly deployed a telemedicine platform. We quickly deployed a Zoom for our employees. And so we did a lot of things in, less than 3 months. And so now I would call it the recovery phase of, okay, let's look at all of this and figure out how can we do this more efficiently. That's what we're working on right now. And hopefully within, the next 3 to 6 months, we'll have a better experience for both our patients and our users, because it impacts patients using, the patient portal and stuff. But so I haven't completely solved it, but I can tell you that our strategic partners are definitely running with us on this and are very interested in, helping us pilot some innovative ideas that I think will help our workforce be more efficient and not complain about security, because, that's always the fun of getting employee surveys is, their concern always is, do we have to do this from a security standpoint? And so if I can find a better way to do it, we'll do it.
Joel, anything you want to add?
I think the answer to that last statement that you made, Jackie, is if somebody, clicks on a phishing email and then they end up exposing, some information internally, as you post their face on your internal website and say, Anthony Guerra is responsible for ePHI that leaked out of the health system, and they'll never do that again. They won't complain ever again, by the way. So not that we did that, because we're not a punitive organization, but I'm just saying if that happened to be the case for you. So I agree with all that Jackie had said. I think we're trying to simplify, but we're still in recovery phase, and we're looking to see how to best optimize the things that we put into place, during the pandemic, and hopefully we're optimizing it for our users, particularly our workforce.
All right, I want to get in another audience question. I enjoy the commentary about patients as customers. Could the panel point to any guiding principles about the pros and cons about this reference? So, Joel, do we like thinking of patients as customers? I guess in some ways it could be helpful, but maybe not in every way we see the term customer.
It's interesting. I was just, I often ponder the use of the word customer, consumer, and recently I was on this panel call, and one of the CEOs said, "I hate the word consumer. We should call them patients." But frankly, the matter is that not everybody is a patient until you really become sick. You are truly a consumer or a member of the health system. But I think the bottom line, whatever word you use, I think the intent is that we as a health system we are a service provider, and we always have to see ourselves that way. I think the traditional health system has seen itself as not being a service provider, but rather as a teller of the patient who is not as highly educated as I, the doctor or the nurse, is this is what you have to do. Well, the new model of care is one of partnership, and in order to be a partner, you can't be just the person being told to do something. And so I think that's what we're grappling with as a health system, as a healthcare industry, is that if we are truly serving the patient or the member, we need to see them as somebody that is really receiving and consuming our services, and we need to treat them that way, with respect, with partnership, and really ultimately with the benefit for them in mind, because they are the ones that are asking for our help.
Jackie, any thoughts on that?
I think, my organization, my CEO would probably answer the question that Joel mentioned about not referencing them as consumers, but referencing them as patients. The reality is they mean the same thing. I think it just depends on, whether you're looking at healthcare delivery or you're looking at a health plan, what they might refer to them as. And at the end of the day, they are the consumers of that. Of the service. But I think to see them called consumers versus patients, you'd see probably a not so wide consensus on the use of that, because I think the term patients just, they're the receivers of care.
Mm-hmm.
And so that's really how, the organization that I'm at views it. And I think generally that's how I see it across healthcare. And so I just don't think consumers is yet widely accepted as a way to name a patient. And you might see patients offended by that term, just because it means something a little bit different. But at the end of the day, we're all focused on the same things, which is, trying to take care of patients the best that we can, and they're consumers of our service.
Chris, we're almost out of time. I'm going to give you the last word if you want to touch on this point or anything else you want to touch on.
Yeah, I mean, I think I'd agree that the name of that particular, patient consumer probably isn't as relevant as simply thinking about maybe the spirit of it, which is, as we can probably all buy into, our mental health actually probably accelerates our recovery, or maybe the reverse makes it more difficult to recover. And so where we can give people environments that just are a little bit easier, a little bit better, a little bit more enjoyable, I think it just promotes the overall kind of healing experience. So I think that mindset probably is a wonderful one for us all to think, and that can just be with our day-to-day, who not even dealing with patients, dealing with team members around us. How do we create environments that make them more productive? Because ultimately that's going to get us all more productive.
Wow, excellent. I can't believe 55 minutes have gone. That was fantastic. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the on-demand recording of this event is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team, and you can go to our website to register for upcoming webinars. With that, I want to thank our tremendous panel, Joel Venko, Jackie Monson, and Chris Byers. And I want to thank Formstack for sponsoring, making the event possible. And I want to thank our attendees for coming. And with that, everybody have a wonderful day. Thank you.
Thank you, Anthony.